Public safety meeting.
Okay. Have a motion to approve the minutes?
So many. I have some questions.
Yeah, that's fine. Let's second the motion first.
I'll second.
Okay. Yeah, no questions.
There are 3 legislators that were marked excused: Nate Emmons, myself, and legislator Castilla. If you look down through the minutes, we all voted. We're part of seconds and different things, so I believe we're here, so there was a mistake
Yeah.
in the designation of the members.
Well, we wanted to, so he knew that I would vote no on it. You knew I would vote no on it, so he did that.
I looked at that and I was like, man, I'm pretty darn sure. I looked down through it and said, oh yeah.
Okay, so we can,
Yeah, he's not, no, we just need a vote to amend, copy paste.
all right, so we need a motion to amend,
Second.
Mr. Emmons, Castilla, and Greco, but
Soloway
as being present. All in favor?
Aye.
Thank you. Good catch.
And I still vote no on it?
And
That's
nothing to do
recorded,
with
Frank.
it. Vote.
Frank, it's in there. You're no. Give him
You
a
don't
red
get to
bull. Give him a red
redo it
bull or
just
something.
because-
That's great.
I mean, we just gave you credit for being here to vote, period.
That's right.
Frank, I can't believe you didn't see that. You see that?
I had more things.
Aye.
I had $200,000 in my mind.
Pressing.
Yeah,
He got
rattled in the meeting just before this one.
that's right.
You're up, Gar.
You ready?
HE1?
HE1, resolution to add New York State healthcare worker bonus funds to the budget. The healthcare workers bonuses were part of the 22-23 enacted New York State budget. The healthcare worker program was payment bonuses for certain frontline healthcare workers. It was determined that 10 employees will receive the full amount of 2 payments totaling $3,000. A budget modification was completed to reflect this.
So this is all state money, has nothing to do with county. It was decisions that they made on the state level.
Did we put this on the floor yet?
No, we talked about it.
We haven't put it on the floor
No,
yet.
it's not what this is. No. That's what this does.
I don't remember a first and second on this, so that's bullshit, but that's all right.
No, we don't have a first or a second.
Okay.
All right, that's what I didn't think, so we gotta get on the floor before we can talk about it.
I'll first it.
Second.
Okay.
Talk about
We were headed there. I didn't,
You know why? I just want before we talk about it, because
speak up.
yeah, I am, I'm trying to word it so I'm polite and don't upset anybody.
You don't have to be
You're not
polite.
gonna upset anyone.
You don't have to be polite. It's not our money.
Hey, I did it in the last meeting, Rich, do it this one.
The problem is, it's our people. And, damn it, I work for one of the largest union corporations in the world. And I'm not saying I'm pro-union or not, but I'll tell you what, you guys work, if you worked in, like here, somebody can call OSHA, and they can close you down in a minute. When you have a union involved, then you have to go through the union process and arbitration and the grievance procedure and all that. It's a lot easier, trust me, it's a lot easier. We're taking a certain segment of people, and I get it.
It wasn't our choice, but.
I didn't say that.
Right, no, I know.
I didn't say that. Vera, I'm not holding you accountable for that. I don't like, first of all, we've got government getting involved in our government. And we have a union contract, and I'm big on abiding by it. Once that's voted on and once that's agreed, that's what you live and die for. And I agree with that. I'm not going to support this, not because I don't know if I'm saying it's not a good idea. It's just everything against my core. And please understand it. It's me personally, I get it, but we're removing a certain segment of people, and they ain't a tough job. But we have a lot of people in a tough job. I just can't. If one of you can convince me that I'm dead wrong, and so be it. I don't think that was going to work. But
The county would get fined if we didn't give to the ones that met the qualifications.
Why the hell is the state government involved in our business? Because they're our employees. And it does create, and I don't care how you cut it and slice the butter before you put it on the bread. The thing is, we're segregating out certain individuals. I have a problem with that.
We are. There was 50 people that were involved with the COVID frontline.
And first of all, I want to make sure you understand completely. It's not you.
I know it's not, because I didn't write the criteria.
I
know. Would have gave to all the
This
staff.
sucks.
It does suck.
Well,
I'd just like to say that, one thing you got to keep in mind, frontline workers worked with the people individually. They weren't out, and they were sick, had COVID, or I don't know where they were in the process, but whereas, yeah, we had other frontline workers out there. We had DPW working, we had other groups, but they weren't in the type of contact that these people were from a health department standpoint. These people were they worked with the masses coming in. They were exposed and in danger more than most of our workers were, without a doubt.
and I will follow up and let you know that any of the agencies that had people involved in community they're called personal assistants, which is OCO, Arise, there's like 5 of them. Those people got as much as a $15,000 bonus from the state. People like us that sat in the office every single day, had to screen everyone that walked in, probably had 10 times the more process to be exposed, because most PAs did theirs by Zoom. We got a $100 bonus. And that was the state. That was the state of New York. Frank?
To go off Rich a little bit here is that I'm a rank and file person. That doesn't mean it's union or, not, the people that are out there working, I don't care if they're union or not union, okay? There are certain people that should receive more money than others, not because they're doing a better job than the other people, but because of their responsibility and their endangerment is higher than the other people. Should some people get a little bit more than others because of that? Well, yeah, but there are issues if you look at, going from a union, okay? If a carpenter sees some dirt on the floor, he can't sweep it up because that's another union's job, okay? So, but this is something different where, like Jim was saying, these people were out there in a different area, and that's the only reason this is one time that I will, be voting opposite of you, Rich, but, I will be voting that way because rank and file is very important to me, whether it's union or non-union. And if you put yourself in danger, okay, it's just like in the service, okay? You got everybody over in an area, but if one person's in a war zone, okay, compared to a guy that's just in the backup, he's going to get, hazardous duty for being up front. But the guys in the back are still the same rank and everything, so they get a little bit more. That's all. But, I appreciate what you're saying, Rich, but in this case, it's the front line, it's the rank and file that I have to stick with and all.
What?
Your department obviously is aware of this.
Yes.
How will it affect your department if it's passed or if it's not passed?
For morale?
Right?
For a morale standpoint?
The ones that know they qualify for it, know they're getting the money, and or they have already received one check.
Really?
Yes. The 10 that qualified, according to HR and the guidelines, which we went through several in services to see who does qualify and who doesn't. Yeah, I had some staff come to me and ask why they don't qualify, and I went through what they discussed during the in-service and explained to them. Mary Bassett, the Commissioner of Health, is working with New York State to change some of the ruling, that especially for health departments, because health departments were really the frontline staff doing the mass clinic sites, the mass testing sites, So more may change in the future, but right now, this is what we got. Some health departments are getting fined because they did not do the approval for the staff that do qualify. Some health departments signed up all their staff, which they know that they may take a hit and have to repay all that money and get fined.
Difficult and go either way.
It is. It's a hard decision. The monetary piece of it was not our decision.
No, not at all.
All right. Any more discussion? All in favor? Aye.
I vote in favor. It's Giving Tuesday. It's National Giving Tuesday. Give it to them.
What have you had?
Phil,
this
you got
morning?
anything else you want to bring up to this committee while Frank is in the mood?
I didn't give anything last
Matt,
month. It is
Yes,
yeah, and no.
And thank you
It's
for
not
your time.
personal, guys, please. don't
Yeah,
take
we
that.
know. We know,
No,
Rich.
it's understandable, because it can go both ways.
I know.
And it will go both ways.
Well, puts her in a damn compromising,
Absolutely.
position. And I don't want my director put in that position.
Right.
I would just tell you off record that we have lost about 15% of our administrative staff within 30 to 60 days of those other people getting those kind of bonuses. Because that was an insult. You know, that staff were the people that were in the office every day, all the walk-ins, all the phone calls. Testing, we had to test every single day in the office because we had people coming in. And the people that were on Zoom got that kind of money.
Well, the governor did it to us again.
Vera, number 2.
This is a resolution to authorize a reclassification of a typist position to a senior typist. The cost increase is absorbed through the vacancies within the department, so there is no increase. This position works for Environmental Health Division, Water Supply Protection Program. It's critical that we retain experienced and competent staff to fulfill the restructuring succession planning. We have had word that one of our long-term staff are going to retire soon, and we've already started training this staff to take over some of those duties. This position will supervise the new typists, ensure complete and accurate data entry and service time-sensitive reports, correspondence for the continuous operation and proficient service.
Okay. Have a motion?
So many.
Second.
Discussion? Frank?
And that, it doesn't really pertains to all of it. In that, Jerry, you made a statement, in here, you said it's going to be absorbed because of the vacancies we have.
Mm-hmm.
And there's many times, and we're gonna hear it, that we got savings, because we have vacancies. You don't, okay? The vacancies are not savings, because we're spending the money in overtime. We're spending the money possibly in overworked individuals that are gonna leave us, creating more vacancies. So, it's hard to say that, this will be absorbed through that. I wouldn't mind paying the money, out of our pocket. If we had everybody filled and we still needed the position, I would do it, okay? So, I just have to bring that out now because I'll bring it out again on the floor that we're not saving money with the vacancies we have. It's hurting us. But I'll be in favor of this because it's Giving Tuesday. It's Giving Tuesday.
Boy, did we miss it.
Wow.
You sure you ain't got anything else you want to bring?
He's looking for lunch, that's what he's looking for right now.
Any other legislative comments? Okay. Now,
So as an observation, Frank's motto of give it to him seems to have different meanings on different occasions.
I didn't say give it to them, I said it's Giving Tuesday.
But I'd like to piggyback on what he said, that just because you have a vacancy doesn't mean you're saving money. More often than not, you're losing productivity because someone has to do that work still. And in the case of positions that require a certain amount of knowledge, expertise, and even contacts within the field, the group that they have to work, the vacancy policy where you have to wait till someone's physically gone before you can replace them doesn't allow the transfer of the knowledge of that person to the new employee. So more often than not, you have somebody who has to kind of try to learn what this person, whether they quit, they got sick, they're going to retire. Somebody has to take that knowledge from that person and transfer it to another person 30 or 60 days later. And in that 30 or 60 day period, somebody still has to do that work. So you really never have the opportunity to do really successful succession work. And then it takes a long time to get that new person up to speed where the retiree or whatever reason they left before they're 100% proficient in what they do. So Frank, keep track of how many times this has happened. I like to do that, but I have to agree with Frank. I think we lose money the longer we maintain vacancies. We certainly lose efficiency in trying to deliver the services that we deliver to the public. For what it's worth.
We have a lot of vacancies.
For what it's worth.
I thought it was great.
According to that theory, it doesn't count.
There's somebody in a different suit over there.
Any other comments?
No, but I agree with that because having been in highway, a lot of times, just with the idea of that is the fact of you get 30 years experience, and when they retire, all that experience goes right out the door with them, right out the door. I've seen that happen over and over and over again, and it's hard, especially in infrastructure and highway, to get somebody to come in to be there for 2 to 4 years alongside somebody to get that experience, because those experiences, they come up on different bases at different times. So it's difficult, but it's very, very essential.
Even a couple of months can make a huge difference.
Sure. Yeah.
Go ahead.
I just want to piggyback off this a little bit, and the fact that coming from the manufacturing end, okay, especially coming from UTC, they went into the ISO 9000 the last year that I was there. That means that you had to know his job, he had to know your job, he had to know her job, okay? Because if he was out, you may not have been able to do it the same speed he was able to, but you knew the job. And it was the way it was a paper trail. Everybody's job was, if the union went against it, man, they were not in favor of it one single bit. But that's why a lot of times I'm against bringing somebody in 6 months ahead of time. You're not going to get you're going to know how to do the job, and I agree with that. You're not going to be able to get it done as fast as them, but we have to have a paper trail, and that's what makes our product better than anybody else's. That's what makes our services better than anybody else's, because just what we went through in the last meeting. If there's a paper trail there, that wouldn't have happened, okay? But that's what I'm talking about as far as bringing people in that early. 2 weeks, I say, should be enough, because you got to know the fundamentals of the job. Are you going to know everything that person knows? He hasn't got 20 years to give you 20 years worth of his knowledge. Okay? So that's what I'm saying, but I agree with everybody in here, okay, on this stuff. And I
Get that, Matt?
I get that down there. But I'm not voting. You notice I hadn't voted no, it's Giving Tuesday here.
Matt, mark him excused again.
Thank you very much. We got a good crowd here today.
Phil?
On the Johnny Carson show?
I've been listening to everyone's comments, and it brought me back to the very first day of public administration school. The first thing they teach you is in public administration, everything is about allocating and balancing your scarce resources, because your scarce resources are all you have in public administration. And when it's vacancies, you have vacancy savings, dollar savings, versus your productivity that Dave was talking about. And the vacancy review policy we have in place now was created because we were scarce on money, a resource. And it's to save money, which now concerned about the human productivity that we have. That's a resource you have as well. We save the money at the cost of the productivity. If that pendulum is swinging back, then that's a discussion we can have, because currently our vacancy policy is waived until finance and personnel meets again in the new year, where they will decide whether or not to reinstitute it, abandon it, or modify it. So if we have concerns, please bring them to me, to the chairman, so that we can fashion a new policy if we need to. Or if you agree with the money is the most important thing, we reinstitute it. If you agree that, we could change that policy to say that that there is flexibility to bring somebody in a month ahead of time on certain conditions. Another thing to think about is, do we universally add to everyone's job description that you contribute to an ongoing institutional knowledge manual of your job? What do you do? And that you're required to do this before you leave, assuming you're not fired. There's different things that we can consider doing. And the opportunity is going to be at the beginning of the year here, because that's when this policy is going to be up for debate, whether we continue it or not.
Thank you. Any other discussion? All in favor?
Aye.
Opposed?
Thank you.
Number 4.
So,
Number 3.
Three.
Pulaski,
Consent.
to initiate the closure procedure for Pulaski B&T Center and surrender the license on October 3rd after our B&T audit from New York State Department of Health. It was brought to our attention that the center located in the Pulaski area no longer provides the services indicated on the license. And it was recommended that we submit a closure plan and surrender the license for that location only. Since we do not staff, store vaccine supplies, or immunization records at that location, and that's been for over 15 years, the license is not necessary. The current license from the main health complex covers all immunizations administered by Oswego County, anywhere in our county. If a clinic was to be held at the Pulaski office, which we do once in a while, we bring all the supplies, staff, anything we need up to that location. So, if we can move forward, that would be wonderful.
Have a motion?
Motion.
Second.
Second. Any discussion?
Yeah, Vera, the bottom line is here is that we still provide what that rural part of the county needs.
Mhm.
It's just.
On that license, they had dentists. I don't know if we've ever had a dentist in that office. Maybe way before me, but there were some really odd things that were on that license. And when the state came in, they said, "You don't need this. We have a little room up there." We used to store vaccine records up there. We moved them all to the main complex. We don't have anything up there except a little room and a little storage area. But we're not staffed, no supplies, no vaccine. There's no need for that license.
Why is the state so hot to get this license back? Out of curiosity, because there's got to be a reason.
I really believe because it's not needed. It's really not needed.
It's just another step for them that they have to track and make sure that.
And it did cost us a little bit of money.
Yeah.
To surrender it. A small fee to surrender it, but that's what was recommended. That's
How
what
small?
No, the fee was actually, there was a fee to update the preventive license, but I don't think there was a fee to surrender this that I know of.
Okay, I think it was like 150. I will get back to you on that,
Yeah.
but I
Well, I'm
believe
just,
that was
you know, the state sticks it to us every time they get a chance. So,
We haven't had an audit for the DNT Center in probably 6-7 years,
really,
right? And why it wasn't caught before, that's up to the auditor.
And there's no reason they need to be subjected to an audit over something we're not doing anyway.
oh yeah, they'll find something, they'll make something.
Well, then yeah, something else.
Yeah, no, if we don't need it, we don't need it. It's just, it seems odd that it went this long. I mean, you know, I just don't understand that, that's all.
Me either.
Jim?
You know, and I gotta believe, at least from the state standpoint, or from they're proving their point in that we took care of COVID without really using that facility as an area for holding, to give shots or even to
Right.
have it open for people coming in.
Yes, and we
So they kind
have,
of proved the point.
right. And we did vaccine clinics up there.
Right.
And we will continue to hold them.
Yep.
But it comes off the main license.
Yeah.
Any other comments? All in favor? Opposed?
It cleans us up a little.
Now number 4.
Dr. Lipkes is up for reappointment as medical director. She's a board certified family medicine practitioner. She has been our medical director since January of 2014, overseeing immunization efforts, follow-up on lead and TB cases, medical responses to public health emergencies and threats, along with many other tasks. She also serves as our hospice medical director since April of 2014 until November of 2022. She's professionally credentialed, background checked, immunization records, and licensure is all in satisfactory condition.
So moved.
Second.
Any discussion? Bill?
I just have a question, has this been done every 2 years at this time? I don't,
Now it will be.
now, well, yeah, my concern is that all appointments, I want to check between now and the legislature meeting if this position falls within this realm, but reappointments by the board is usually limited to the term of that board. So in which case, this could only be for 2023 because that's when your terms expire. It can't go through 2024. So normally, when the legislature appoints a position like this, it's done at the organizational meeting, and it's for the full 2-year term of that legislature's term. They need to
Okay.
coordinate.
So next year I do it again.
So
what we would do,
Amend it?
if possible, well, I want to verify it, so this will have to go to finance and personnel, so I'll check by then. Finance and personnel could amend it to expire December 31st, 2023. That's what we got to do. And then at your organizational meeting in January of 24, get this position on the 2-year cycle along with all the department heads and the others that are appointed at that time.
Okay.
So,
Okay.
and I don't remember, does Board of Health have to?
The Board of Health may have to approve.
They did.
We did, if I
Okay.
remember right.
Okay.
We did.
Okay,
Board of Health technically is supposed to approve this and the public health director.
They did.
Alright.
At the
so
last.
that'll be the methodology here. If it's not right, we'll fix it,
Fix it at FP.
F&P. They're the fixers.
And they may need to put, well, this is within your term, so it's okay.
Alright.
Go ahead.
You can go now too.
Nah, that meeting would be over quicker than the one you had yesterday when they
No,
come to
here we
the
go.
courts. Yes, okay, goodbye.
If you feel yourself slipping here, we'll go really quick through the rest of it, since you're
No.
giving Tuesday.
Hey,
Any other discussion? All in favor?
Aye.
Number 5,
This is the hospice RFP. We did receive one proposal from the Essentia Health. A review committee was determined that this would be a good fit for our county to continue hospice services. Some highlights include 130 years of home care experience. They have provided palliative and end-of-life care to patients. They are ready for a seamless transfer, a timeline of 4 to 6 months, and it could be sooner. They have extended employment opportunities to existing staff. Upper management has experience with hospice care. They have been recognized as the best place to work in New York State and ranked 31 out of 150 for best home care companies to work for. They have offered $100,000 to purchase our hospice.
Need a motion to put in those?
So moved.
Second?
Second.
All right. Any questions? Phil?
Has anyone checked their state inspection reports on any other services they provide? Have they been written up for anything?
No,
Okay.
no, it was.
Are they inspected and regulated by the state?
They are inspected and regulated by the
Okay,
state as a CHA. They run a CHA right now, a
Okay.
certified home care agency.
Yeah, they run a hell of a home service.
And wouldn't those records be available for review?
Yes,
Okay, so we can get that done prior to the legislature meeting, probably.
okay,
Just for reassurance.
okay.
Okay.
If I make myself a note of that.
And is there, did they ask for any, is there a overlap time of management? Or is it a straight cutoff and they take over? Are they also doing the bereavement services or we continue?
They would take over bereavement also.
Okay. So it's a straight cutoff, there's no transitionary period or co-management period?
That's correct, but they do want to sit with us and review and go over what our policies were, which I've kept everything, and
Right.
so I would work with them and do an education training.
Okay, yeah, I'm just thinking back to the nursing home because we still had patients. There was a period of time where the state had to approve the new owner's acquisition. And so we had to continue, we had to do a management contract with that entity until the state did an approval. And that was because we were still running a nursing home, have patients. I'm assuming that's not the case here because we don't have patients.
Right, we just have our bereavement.
And does the state need to approve them taking our certificate?
Yes,
Do we know how long that process will take?
they said it could be, according to Nescentia, they're thinking they will be totally take over within 4 to 6 months.
Okay. So they're doing the bereavements during those 4 to 6 months or we are?
We are until they can, till I surrender the license. That's what you
Great.
meant, I'm sorry.
Okay, all right.
It took me a second.
Okay, all right.
So we'll continue services until we surrender our license
Okay,
to them.
thank you.
Any other comments? Right.
Don't be surprised when they do that background check on them, that they will have issues for home health care, visits and things like that. You're gonna see those.
Everybody does.
Right. That's why I just wanna make sure.
Right. But some have it more than others. That's where.
Correct. No, they do.
So back when we sold the nursing home, one of the things we checked, we found that some of the proposers who were offering a better deal had horrible records. So we disqualified them.
Correct. All right. Makes sense.
They seem very referable.
I don't think there'll be a problem, just due diligence.
Okay, yes.
Okay, and as a final comment, Friends of Hospice is not going away. That is still a county program, nonprofit, that serves the needs of the families. So that program still is in existence. It has no intention of leaving. And anybody who has done the hospice, CNY, Jefferson County, that's filled in, they are very much pleased with the fact we have a very strong program in this county that does Friends. If you're not completely familiar with Friends, Friends does the things like it's my birthday coming up, passing away, the family can't afford to do anything with medical costs, they'll buy a cake, they might get them a gift card so they can have a good meal. They do holiday meals, they do blankets for people, they do special pillows, special equipment that isn't covered medically, small things like that. And the program is very strong, and People love it in this county because even CNY now is reaching out to try to find out how they could do that down there because it's that strong here and it's not going away. Okay? Because somebody put me on that board. Anything else? All in favor?
Still need
what?
first and a second.
I thought we did
We
that.
did the hospice. I thought we did that. No?
Yeah, we
I'll
did.
first
Oh,
it.
No, we
Second.
didn't.
I thought we did.
Because I asked to speak about it after the motion.
Oh, sure. There you go. That's in solid.
No, I remember it, and I'm
No,
70.
Yeah.
Of course, that might have been last year's motion, but. You got names?
Nope.
Who made the motion?
I seconded it.
He seconded.
I first did it.
Yeah.
Okay.
Right.
Oh, yeah, it's Giving Tuesday. Frank
I
did.
must have been
See
dreaming.
Tuesday. That's a take though. This is a pay forward.
Okay.
RFP for electronic medical record server. We received 7 proposals. The review committee unanimously voted for Patagonia Health and determined it will be cost effective and meets all the county's needs. Some of the evaluators noted 10 plus years experience working in public health, and they serve several of the New York State counties. They have support 24 hours a day, 7 days a week, 365 days a year. And no cost savings will occur the first year due to the implementation, but years 2 through 5, there will be an over 50% ongoing cost savings.
Got a motion?
Motion.
Right? Second? Okay, we'll pause to make sure you get it.
I got it.
Oh,
I got
okay. Any discussion?
Roll call vote.
Is this the last one you had to get in there?
There's a lot.
You want a roll call vote?
I asked for a roll call vote.
Okay, roll call vote.
I don't even know how to do it.
You have to name the legislator.
Every legislator and ask their vote.
All right.
Now, this is part of that overlap training you didn't get.
Alphabetical order, Matt.
All right, Legislator Castilla.
Yes.
Legislator Vine.
Yes.
Solid Waste Scanlon.
Solid.
Legislators, well, no, you're next. Karasik.
Yes.
Legislator Scanlon.
Yes.
And Legislator Soloway.
Yes.
Okay.
Thank you.
Motion passes 5-0.
I think that's the first time ever.
I don't think I've ever had a roll call vote.
I just,
Roll call
the only reason I
vote.
saw it is because I saw it on the bottom down here, it says, you can ask for a roll call vote. That's what I asked for.
Vice Chair under Jack
Right,
Prout
you're a
for
history
years.
major. Everything you've done is
Vice
history.
Chair under Jack Prout for years.
Give it a
Chair, and never had that. Okay. You want to do ARPA next?
You're the chairman.
I'm the chairman. Let's do ARPA next.
All right. So we have 3 for your consideration that have been suggested by the task force. The first one is Farnham. They asked for $195,495 to expand their services for substance abuse counselors. About 50% of the project that they're proposing was for alcohol treatment, and about 50% was for opioid treatment. And the task force recommended 50% of their request with the suggestion that the other 50% come from the opioid settlement.
And that is budgeted in the tentative budget.
The other half of that. Okay.
And so that's contingent upon this one as
All
well.
right, so I need a motion to discuss.
So moved.
Second?
Second.
Any comments? Frank?
But why can't it all come from opioid?
There were others, we're trying to maximize the use of the opioid settlement. There were other programs also suggested for that. So this, by splitting it this way, since half the service is not opioid related, we're able to maximize the opioid money to allow some other opioid services to be funded as well. And the opioid settlement monies has restrictions on it. So I don't believe the alcohol services, the other half of this, would be able to be funded through that.
I don't know, I'm having a flashback, or I dreamt about, but I think this comment was before. Did we have this discussion once before about the same thing?
Probably,
Because the
probably when
alcohol-
you were talking about the budget. Yeah.
No.
Earlier this year.
Yeah, something, yeah. Okay, all right, okay, thank you.
Yeah, didn't, and I haven't got it in front of me, obviously, but isn't in the state budget, they put more money into this type of, subject matter? They increase the funding for that too?
Possibly, but I don't know that that money comes to the county.
Pardon me?
That may be for state programs. I don't know that it comes to the county, or it may be through competitive grants. The opioid settlement money comes directly to counties for use on opioid treatment programs.
Yeah, no, I get it, I'm all for it, and I just wondered, because I know there's a lot of money being thrown into these programs, and it rightly so.
And well, the receipt probably isn't gonna be enough to handle the problems we have.
Right. So they were able to document a significant amount of need that increased throughout the pandemic period. And that's how we were able to bring it in under the ARPA qualification.
Anything else? All in favor?
Aye.
Opposed? Number 2,
So do you want a motion before we discuss, or you want me to just explain?
explain it, then we'll do the
Okay.
motion for discussion.
So St. Luke's has amended their request a couple of times. Originally, they were hoping to get some funding for this, and also some funding for recruitment and retention of professional staff. And it was suggested that perhaps they could focus more on the needs of the facility and the people working and being cared for in the facility, and how to make that better, a safer environment for those people. And they did have this project where they want to increase the air quality in the building. And there's two ways, like two parts to that project. One is the individual units within every single room, and the other is the overall system that treats the whole building. And they broke that down into two parts. They prioritized the individual room units as the most important step for them to take and the most beneficial. And that's what the task force suggested for your consideration, was they're funding the replacement of all those air units as opposed to the whole building system.
Okay, can I have a motion for discussion?
So many.
Second?
Second.
Any comments or discussion? Frank?
I just would like to give them, the requested amount. Make a first on that. I'd make a motion to give them the requested amount instead of the task force suggestion.
In line with, they're giving like 50% of the project that's requested in the other ones.
No, this one is,
I think that's why they went
yeah, this is
3 or 4 to
different.
1 project.
This is different. They went with the one project, but the thing is you had Oswego Health asked for 500,000, and they got 500,000. Didn't they? And that's why I'm saying.
They did, yes.
Right, so that's why I'm saying, this is another, agency that, I feel that, all of it is related, and, that's why I make the suggestion. If nobody wants to second it, if you don't second it, we don't vote on it.
Right. So Connects Care also made a request for their facility in Pulaski area for $500,000, which was approved previously. But that was part of like a $4 million project overall. I think the part of the discussion at the task force was that this was pretty much the whole cost of the project as opposed to like a shared cost. And that's why they kind of broke it down that way.
And I had an opportunity at another event to talk to the CEO of St. Luke's, and she made it very clear their biggest priority is the room quality. That's the biggest offender right now, and that's the piece that they really, really need to get fixed. And yes, I think the total package is the whole total package, period, of doing all the work. But she did make it clear that if there was a choice, she wanted to make sure the committee understood that the rooms are more important than anything else. And if you remember, I questioned this and held it back anyway because I wasn't sure. And then I was at Bishop Commons for another event. She was there, and we spent some time talking. And like I said, her priority is the rooms, so that the patient quality is better.
Did she mention anything about having plans to do that other project, even if they don't get this money?
Didn't even bring that piece of it up.
She did not.
Just said that the thing that they need to focus on as quickly as possible is the air quality in the rooms.
They both need to be done, they're both original equipment, and they both need to be done, but again, they prioritize, if we had to choose, they prioritize that. And just the suggestion from the task force is only a suggestion. What you give to anybody, or whether you give them anything or more than what they suggest, that's up to the legislature.
You're talking about the air quality, but we're talking about an HVAC.
Yeah, my question
There's
is,
a difference there. I mean, one is the roof, and the other one's in the rooms, right?
yeah, my question is, which building are we referring to here? Because 80 units for that high rise, is that really gonna cover much?
I think there's 80 care rooms
Okay.
in the facility, yeah.
Yeah, it covers, the room one covers all the rooms with patients.
Mhm.
The other one
I would say,
covers common areas and everything else, right?
Yeah.
You're talking about being able to make it comfortable and living areas. The HVAC unit, I would say, is gonna do that. That's why I think that they're both just as important. That's all I'm looking for is the whole amount. I made the motion, I didn't get it, so
Okay.
it's on the requested amount now, so.
Any further discussion? Okay, so on the requested amount, all in favor?
Aye.
Opposed?
I can't vote no on it.
Thank you.
We need it.
I think we got one more.
Yep, this is a small business in the city of Fulton. They've had this building for a few years now, and have been renovating it and adding new services, and specifically these red light therapy booths are shown to help with COVID and other respiratory type of illnesses. We did actually a little bit of research with National Institute of Health and other people, because we'd never heard of it before, but this is kind of the last part of renovation that they're trying to do to their business to be able to provide this treatment therapy as well. The very bottom one.
Beauty and bold.
Yeah.
Let's do a motion to discuss.
So moved.
The motion.
Second? Okay. So what did the research show? You said does it show that this works?
From what we were able to find out, yeah.
So if I put red lights in my bedroom,
You're doing good.
go to
You
sleep.
might get a couple different responses.
Couple nights on the door.
But the criteria
Take that off
for
tape.
approving it doesn't come anywhere involving whether it works or not.
What's that? I'm
It
sorry.
doesn't make any difference whether it works or not to qualify for this.
So this is qualifying under the benefit to public health,
Right.
and because they were able to demonstrate that the service that they're going to provide does have potential impacts to help treat COVID type diseases or ailments. They were able to qualify under that.
Where are they located?
So if you're familiar with
Don't get
First-
smart.
41 as it goes through Fulton.
Yeah.
Where
Candy Street.
the, yeah,
Across from Burger King.
across from Burger King, it used to be a Niagara Mohawk
Oh, yeah.
place,
okay.
like I consulted a long time ago.
Yes.
Yes, I consulted before. after.
Yeah, it was nice, yeah, after that, okay. Vera, you ever hear of this before?
Red light therapy, I always heard about it for skin. So people with psoriasis, it does provide relief and increase the healing time.
Okay,
Or decrease the, yes. So it's good for skin. I haven't heard anything about the COVID and the respiratory.
but it does have a medical therapy.
Absolutely, yes.
Okay.
Company has asked for 25,000 and already has 5,000 set aside to complete the $25,000 project. So if they put $5,000, why are we giving them 25?
So they have, they spent 37 already, right? So typically we look for at least 50% of the project cost. And so, the 25 fell even below the 50% of the project cost. And the, committee said, you know, it's a small business struggling to get going, if they can use the 5,000 for something else. But again, it's just a suggestion. You're welcome to modify those numbers in any way that you'd like.
Yeah, it is strange, they're telling you they banked 5,000 towards this, and they're asking for 20.
Well, I think they were trying to demonstrate that they were committed to making it work in case we didn't give them the full amount.
Okay. That's up to you guys. Want to run it as is?
Where it is.
Okay. Any other discussion?
Roll call vote.
Twice. Do we have any more of these?
Matt, did you do something to make it?
I don't, this isn't really a formal vote, is it?
Yes, it is.
Yes.
Yeah, that's it, it's gotta go through committee to go on.
It's not a resolution, I know.
Yeah,
It's not a resolution
It
yet.
says right on here, roll call vote.
Not on this one, then. I just wanted to make sure we could do that when it's not a resolution. All right, yeah.
I'm just checking to see if we have any more, because I don't have the
No,
lead.
that's it.
Three is unlucky, you know,
No,
3 in depth,
that's it.
3 in, 2 we're fine with. Okay,
This is
roll
it,
call's
we
fine.
just got updates.
All right,
All right,
well,
legislature.
now you know how to do it. You
No.
just have to prove it.
All right, legislator Karasik.
Yes.
All right, legislator Scanlon.
Yes, for small businesses.
Forgot Klein.
Oh, sorry.
That's
Legislator Soloway.
Yes.
Legislator Klein.
I'm gonna abstain from this because they said they have, they said it, or I assume they said it, whatever, that they already have $5,000 set aside to complete the $25,000 project. I mean, it was 20,000, I get it, and I have no problem with that, but I'm going by what the paragraph's up. I mean, that's the way I read it, maybe I'm misreading it, but.
Okay.
We're just trying to give you a summary of the
No, they-
whole
right now.
application.
Motion
Yeah.
passes, 3 in favor, 1 opposed, 1 abstention.
Wait a minute, I didn't hear Frank's name called.
I said no.
Yeah, he was nowhere at the bat. He was
Oh, you
the
were
first
a
one.
no off the bat?
For small business.
Okay.
In full.
But it's not, it's too.
For a small business.
In your
There was a
district.
lecture,
In
and we
your
are giving it
district.
to small
I know,
businesses.
I know.
And now it's going to small business and you're saying no.
No, this is not,
Okay.
this is not,
Don't
this is
miss
not
that.
something that was in effect
That's okay.
during COVID, before COVID.
And I don't want anybody to misunderstand
This is
that I
something to
mentioned the
follow.
fact there's a red light in Frank's district.
Well, just for just for clarification, one of the qualifiers is that they have to be able to demonstrate that they were substantially prepared to be in business or in business. I mean, that's in the law, and we do check those things. So
I know.
they have to have like a permit from Department of Health or whatever agency might oversee their type of work. In case of a restaurant, maybe they have their liquor license already. So we take steps to make sure that pre-COVID, within the qualifying period, they were either operating or prepared to operate.
I understand.
Just to clarify that for you.
I just think it's,
Okay,
snake oil salesman.
short director's report or long? You need to take a break?
You need to take a break?
No, go ahead. He was,
He's being facetious.
Okay. I'll be quick. I'll go through it fast.
You're fine.
All right, we will be offering a healthy living workshop
Thank you.
class in January. Participants from our Stepping On class have been enrolled in this workshop. The team is working on developing a survey, or we worked on developing a survey for the community engagement for our community health assessment. We started analyzing the results, and some of that will be included in our community health assessment plan. The community health assessment and the health improvement plan is going through the final updates after the group's feedback, and we will be submitting a joint document with Oswego Hospital in December. Actually, it should be done by the end of this week. The fellows attended the New York State Fellows Core Program Fellowship Summit, and we actually were the panel for discussion. We hosted the breakout session. It was well received, and we received great feedback for our program. Strategic Planning Committee hosted 2 in-services for our staff on adverse childhood events, and that's part of our new OCHD Presents series where we're doing staff education. Many requests are coming in for education and outreach activities from the school districts. We have been busy with Scrubby Bear, which is a hand washing and germ prevention program, dental hygiene, and vaping. We will be participating in a training. It's called Catch My Breath. It's an educational program on vaping targeting middle schools and high school students. We participated in the trunk and treat at the Speedway, and we did give out 1,900 toothbrushes. I know, that was really good.
Wow, you're gonna save some teeth.
I know, we're trying.
There was a lot of candy too.
If they handed out all the candy, we could do
Yeah.
exactly.
We continue to send out the community newsletter to keep our residents that are subscribed up to date on what's going on at the health department and what's going on in the news. Working on improving our data collection for overdoses, intentional self-harm, and suicides. More information, a lot more to come on that in the future. Rabies clinics will resume in March of 23. I will have a proposal ready for your review at our next meeting for the schedule. EI has authorized 42 post-human exposure cases. In 2022, that is up from 36 cases last year. Some of our facilities that we have permitted 46 in November already. Well, we've a couple more days. I don't think we're going to do very many more. And that's all categories. That's the food, the mobile home parks, campgrounds, migrant hotels, children's camps, water pools, beaches, and that's a total of 871 so far this year. Our lead poisoning prevention program statistics, 65 open cases currently. We received 18 environmental lead referrals, and we've closed 11 so far this year. Our complaint program, to date, total cases opened in 2022 were 59. We've closed 45. We had 32 garbage complaints this year, 18 septic complaints, and 9 rodent complaints. Preventive report, our flu clinic continues every Monday and Friday, 9 to 11 and 1 to 3. We are seeing a moderate amount of people for a vaccine, but pretty much everyone's offering that vaccine, so that's okay. We continue to provide homebound flu and COVID shots, which our staff has been busy with. We are having our next COVID booster clinic on the 14th, right at the health department. And we're only offering Pfizer. It's easier, it comes in smaller dose vials, and now the state has made 1-dose vials. Yes.
I hate to break you right here, but there's something you just said.
Mhm.
You said we're giving homebound people,
Mhm.
residents,
Mhm.
shots and all that kind of stuff at their home.
Yep, we go to the home and.
All right, now, are part of those part of that frontline workers that are getting that bonus?
Yeah, they're the nurses.
Pardon me?
Nurses are going out to the homes.
Yeah, but is that part of the
Yes.
bonus people? Okay,
Yeah.
that's what I want to know.
Pretty much the bonus was, the only ones that qualified were nurses and social workers. Okay. Flu cases have rapidly increased over the past month. In the month of October, we had reported about 30 cases of laboratory confirmed cases. In November, we already have 200 cases. And that was last week. So that's probably doubled. We've sent out another press release on the importance of getting your flu vaccine, and we did that on the 23rd. We've created a flu portal on our webpage. It's called Local Flu Data, and that is getting updated weekly by our epidemiologist fellow. Our immunization coordinator has resigned. It's a big hit to the county health. We are currently spreading her duties amongst staff until we can hire another coordinator. Maternal child health, the caseload is increasing, which is wonderful. We're up to 8 babies that we're caring for. We have one staff that is dedicated to this program, and she is doing outreach with Oswego Health every week. She's going out there to get more referrals. A lot of head lice referrals are coming in. So we're going to the homes and teaching the families. We use the Do Not Pick education platform for the families. Healthy Families, Cornell Cooperative Extension. We did interview, hired, and she accepted the position, finally. For one of the positions over there, we have 1 left to fill. We have currently a census of 14, and we are hoping to get the other position filled so we can meet our target of 40 families for that program. And that's all I have. Anyone have any questions? Yes.
Nice.
Your mobile home park inspections.
Mhm.
Does our environmental individual, does he red dye these places and see what's happening with the wastewater? And the reason I ask is I'm in a unique situation because here I've got all this wonderful high tax waterfront property in my district, and I have 5 mobile home parks, and they are in tough shape.
Okay, if there's a complaint that comes in, a septic complaint, we will, or a water complaint, we will come out and red dye, yes.
But we don't do that during our inspection.
Not unless we see something suspicious.
Then what are we inspecting for?
While water quality, we'll take water samples, and we have to see evidence of septic coming up through the groundwater.
Or complaint.
Or a complaint, and then we will red dye test. Anybody could call it in though. You could just call
Oh, they're thicker than thieves in these trailer parks. You have no clue. They aren't gonna say nothing. You think they're gonna rat on each other?
But if the
That's not gonna
inspector
happen.
goes around and they do get an odor or any suspicion, they will test it. Yes.
Frank,
Yes. The immunization coordinator,
Yes.
are you able to tell us the reason this person resigned? Did they move out of the area, or is there other
Nope.
contributing factors?
Took another job.
Higher
Loved-
paying?
Yes.
Big hit to the county.
Wanted something new.
Oh, all right, okay, so, I just, you know me, I'm bringing up
Mhm.
money all the time. I want to see our
Mhm.
rank and file get paid better, so we can keep them. But, you added to it that it's not so much money as it was that she wanted a different avenue.
I'm sure the money had something to do with it, but
Okay,
definitely another avenue too.
okay, thank you.
any other comments? All right.
Excellent job, thank you.
Thank you.
Thank you, Hero.
Yeah,
Thank
very
you.
good.
Thank you.
So
Thank you.
before we adjourn, I just want to let everybody know that Saturday, my wife and I celebrated our 40th year wedding anniversary.
Congratulations.
Snuck away so the kids couldn't find us and had a nice supper. And it rained, which 40 years ago it rained. So, okay, can I have a motion to
So
adjourn?
made.